Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is the flu in children. What makes a child high risk for severe flu?
All children under 2 are at high risk for severe flu. Also, children with certain health conditions like asthma, heart disease, cancer, immune issues, severe disabilities, any of these things make a child at higher risk for complications from the flu. Also, very obese adults are at high risk, so it would make sense that very obese children would be as well.
At this point in the season, what is the best way to prevent your child from getting the flu?
The best prevention for the flu is to get the flu vaccine, which is very safe and effective. One change in the past couple years is that even if you have an egg allergy, you can still get the flu vaccination. And then also important is hand washing. So you want to teach your family and your young ones to wash their hands especially before they eat or touch their face.
Is it too late to get the flu shot? And how long does it take to become effective?
It's not too late. The flu season lasts typically until March, so it's not too late at all. And if you get the flu shot now, it takes about 10 to 14 days for it to be effective. One exception is infants who need 2 doses.
How can a parent tell the difference between the flu or a bad cold?
So with both the flu and the cold, you get a runny nose and a cough. But when people have the common cold, kids can still go to school, parents can still go to work, you can basically function. Now with the flu, the cough is more severe, there's a high fever, people have a lot of muscle aches, sometimes vomiting and diarrhea. I mean, one thing I've seen on the internet is, do you feel like you've been hit by a bus? If you haven't been hit by a bus, it's probably the flu. So people usually can't go about their daily life if it's the flu.
Once a child has the flu, is there anything parents can do to prevent complications?
Well, if they're one of the high-risk groups that I mentioned earlier, you want to call your doctor and have a discussion about whether or not Tamiflu could be helpful. And then you want to make sure they stay really well hydrated. You can treat the fever with Tylenol, and if they're asthmatic, you would want to give them their asthma medications as needed.
At what point should parents call their child's doctor or go to the emergency department?
Well, if you're a high-risk group, asthmatic, heart disease, anything like that, you would want to call your doctor if you have the flu and get them seen. If your child gets dramatically worse several days into the flu, you would also want to have them seen, because one reason is that kids can develop pneumonia after the flu. And then if your child has trouble breathing or they're really lethargic, you can't wake them up, they're not walking right, they're confused, they're not making sense, any of these alarming signals, you would want to take them to an emergency room. But really, whenever you're worried and have a question, it's totally okay to call your pediatrician. That's why we're there.